Hi, I'm Dr. Blink, and we're starting a new series, Peri-Ocular Fillers. So what is the periocular area? Peri means around, and ocular, of course, is the eye. So this area will inject with hyaluronic acid dermal fillers. And why would you want to do that? It's for if you've got fine lines, hollowing, dark circles under the eyes. Remember that this is an area which carries a bit of risk if it's not done by an advanced aesthetic practitioner, because the skin is very thin, there's little blood vessels there, so it must be an area that's injected with caution by the right doctor. So one of the mistakes that sometimes patients make when they come and see me, they say they just want 1 mm filler for the tear trough area, that little bit of hollowing underneath the eyes. Remember that the periocular area, the area around the eyes, is made up of different components. So the outer part is the temple, this part is the cheek, and then you get the mid-face, and then finally you get the tear trough. So sometimes in order to get the optimal result, you need to address each individual component to get the wow effect. So remember, in this area, there's different layers, and each layer is aging. The layers include the skin. The skin becomes crepey with age and loses a bit of collagen, becomes a little bit thinner, and there's specific treatments in order to address that. Also around the eye, there's a muscle called orbicularis oculi, big word, but that muscle we can try and relax with a bit of botulinum toxin. There's also the fatty layer. This is a very important component, especially when it comes to dermal fillers. There's different fatty compartments around the eyes. So there's something called the roof, which is above the eye. Then there's the souf, which is a little fatty layer just underneath the tear trough, which is a very important layer when it comes to fillers. And then there's also the deep malar fat pad, which is a deep fatty component, which is the mid-face of the cheek, which one can also address with fillers. And then they get the tear trough, which is just that little hollowing underneath the eyes. There's ligaments involved, there's septa involved, and there's also the bone. And the bone also, there gets resorption of the bone with age, especially underneath the eye and this maxilla area. So each layer needs to be addressed with the right type of treatment in order to get the right optimal result. So today I want to address two patients that come and see me. The one, patient number one, is the one that comes with a hollowing underneath the eyes. The second patient is the one that comes with a complaint that they got puffiness or eye bags underneath the eyes. So patient number one with the hollowing under the eyes, this is the ideal patient to treat with dermal fillers. There's various causes for this. It can be aging, weight loss, or even genetics. So dermal fillers can just smoothen out and replace that volume loss beautifully. The second patient is the patient that comes with the under eye bags or the puffiness under the eyes. Also, there's various causes for this, things like allergies. It can also be just the under eye, a bag that sits underneath the eye that is bulged forward. Sometimes surgery is a better indication for this, or sometimes the dermal filler. Dermal filler can't get rid of that puffiness or the under eye bag, but it can definitely smoothen it out and just make it look a lot better. So some of the frequently asked questions are, is this filler underneath the eyes painful? So the pain level is about a mild to moderate. And how long does the procedure last? It's about 15 to 30 minutes that it takes. And your fillers will last you about 9 to 12 months. When injecting dermal fillers, important is to minimize risks. Things like you don't want to be traveling internationally for about a week after fillers, and then you shouldn't have any vaccines for about 3 to 4 weeks before the fillers, and also no infections just before the fillers as well, or no dental work for about 3 to 4 weeks before the fillers. And then remember, of course, don't do dermal fillers, tear trough fillers, or periocular fillers just before a big event. Plan it properly. Give yourself at least 3 to 4 weeks before an event, because we're using needles or cannulas, so there's always a risk of bruising.